Are you one of the thousands of New Jersey Medicare enrollees that is insanely confused about Medicare annual enrollment? Are you getting flooded with mailers and phone calls and seeing all these commercials and wondering what all the fuss is as it relates to your Medicare? Well, we are here to help cut through the noise and give you a free educational video on what Medicare annual enrollment is for you as a New Jersey Medicare enrollee, what you can do, and to give you all the insights and trends that you might be looking out for to make sure that you have the Medicare situation that is right for you. So my name is Ken Connolly. I work for NJ Life and Health. We are a local family-owned brokerage right here in New Jersey that has helped 4,000 Medicare enrollees just like you, and we want to help you as well. We're going to be talking about what you can do during Medicare annual enrollment. We're going to be showing you the New Jersey specific trends as it relates to Medicare Part D, Medicare Advantage, and Medicare supplements. And we're also going to talk about how you can work with us if you would like to have someone who can help you with your Medicare and see if you are in the right situation for your specific needs. So let's dive into it. Let's start off this video with what Medicare annual enrollment is. Medicare annual enrollment takes place from October 15th to December 7th. This is the Super Bowl of the Medicare world. This is where the vast majority of Medicare related enrollments happen. We really think it starts on October 1st when all the companies make their plans public. So whether it's your current plan telling you how everything is going to change, or if you want to see the other plans available in your area and what their offerings are going to be, this all becomes fully public on October 1st. So be on the lookout. So we know the enrollment period. What exactly can you do? Well, you can move from one Medicare Advantage plan to another Medicare Advantage plan. You can move from one Medicare Part D plan to another Medicare Part D plan. If you want, you can move from a Medicare Advantage plan to Original Medicare, or if you want, you can move from Original Medicare to Medicare Advantage. This enrollment period lasts from October 15th to December 7th, but any enrollment you put in is going to start on January 1st, 2026. And just so you know, it's the last enrollment you put in. We don't recommend it, but you can technically, enroll as many times as you want during this period, and it's the last piece of paperwork you put in that is going to be the one that sticks and the one that starts on January 1st, 2026. Now, you might have seen that slide and heard me talk and say, but what about Medicare supplements? Well, contrary to popular belief, Medicare supplements are not tied to Medicare annual enrollment in New Jersey. They are actually year-round, meaning you can switch Medicare supplements year-round, provided you go through underwriting. If you don't know what underwriting is, it is really just the process of insurance companies determining, is this person healthy enough to be accepted into this new Medicare supplement? I think that due to Obamacare, a lot of people think that pre-existing conditions have been waived in every single type of health insurance product, and it is really not the case. Medicare supplements in New Jersey do have the right to deny you based on pre-existing conditions. It's not a crazy list or anything like that, but just know switching between Medicare supplements is not guaranteed, and this is especially relevant if you're in Medicare Advantage and you want to switch to Original Medicare plus a supplement. You're going to want to get confirmation you've been accepted by a Medicare supplement before you make any moves. So the big elephant in the room is Medicare Part D, otherwise known as prescription plans. Now, the first part to know is that there are currently in New Jersey 14 Part D plans, and next year there are going to be 12. The big headline this year is that in 2025, the average premium for a Part D plan was about $61 a month, and it is going up to about $78 a month in 2026. A lot of the plans that are under $5 a month, under $10 a month, under $20 a month are going up in a big way, and it is definitely stressing people out. I can tell you from direct experience, I've gotten about 24 calls from people telling me about their Part D increases as they've gotten the notices in the past week or two. All my colleagues have fielded the same calls. And the fact is, these low-cost prescription drug plans, these Part D plans that were, like I said, under $10 or $20 a month, are going up in price or going away. And the sad part is there isn't really a great solution. It appears the market is just moving towards higher premiums, and it's very unfortunate. Now, the reason for this, just so you know, is more of a federal level thing. So the Inflation Reduction Act added a $2,000 out-of-pocket max to all Medicare Part D plans in 2025. What this means is even if you are on a boatload of very expensive prescriptions, the most that you have to pay out of pocket for your prescriptions is $2,000. This was a huge step in the right direction. When I personally first started getting into Medicare in about 2020, it wasn't that uncommon for people to pay $3,000, $4,000, $5,000, $6,000, $7,000, or maybe even $15,000 for their prescriptions over the course of the year. The federal government said that's too much, so everybody's maximum is $2,000. The insurance companies turned around and said, we're losing a lot of money offsetting all these, crazy costs associated with the Part D plans, so we're raising costs on everybody else to offset this. So it's unfortunate. A lot of people who were really struggling to pay their prescriptions have, really lowered their total out-of-pocket expenses, while a lot of people who are on a handful of generics, maybe one or two, are wondering, why am I paying $20, $30, or $40 a month for this one generic? Now, this makes it hard, but we do not recommend dropping Part D because it can leave you super exposed if you suddenly get prescribed a brand name medication. But to build on this, one of the unfortunate things is that most of these Medicare Part D plans no longer have commissions, which means brokers like me don't get paid to sign people up for these plans. It was the case for a very long time that they did. Last year, we saw a lot of companies say we're not doing it anymore, and that trend has only continued, which is unfortunate because in my eyes, my own personal eyes, Medicare Part D is the most complicated part of Medicare. This is the thing that people need the most help with, especially when they're seeing these big monthly increases. It may be hard for you to find somebody who's willing to help you out with your Medicare Part D. Unfortunately, people like us just don't get paid to do it. We are always happy to help you out, so give us a call if you have a question. We do talk to our clients about all this stuff, but again, it can be hard as we're no longer compensated to do this. Now, moving away from Medicare Part D, we're going to be talking about Medicare Advantage. Now, if you are in any of these counties, being Bergen, Passaic, Camden, Hunterdon, Middlesex, Morris, Somerset, Sussex, and Warren, be on the lookout because a couple big Medicare Advantage plans are most likely leaving your area. I understand that people are like, I get so much mail, I don't even know it's for me, I don't know it's an ad, I don't know it's spam. Please just check. This is the one time of year where you absolutely need to sort through your Medicare mail and make sure that you are not going to be losing your Medicare Advantage plan. The actual word for this is termed. This is when an insurance carrier consolidates their offering. They say, we have 6 plans, we only want 4, so 2 of those plans are going away. They're getting termed. And what usually happens is you get to keep that plan till the end of the calendar year, and then come January 1st of the next year, you're only going to have original Medicare. You're not going to have a Medicare Advantage plan. So please stay on top of this because if your plan is getting termed, you have all of Medicare Annual Enrollment to be able to choose a new Medicare Advantage plan or to make the decision to take a Medicare supplement, look through drug plans, everything like that. So just be on the lookout, double check everything, and make sure that you have what you need to be protected and have the coverage that you want come January 1st of the following year. And a couple general trends for the New Jersey Medicare Advantage marketplace. We have seen quite a few PPOs go from $0 a month to maybe $30, $40, $50 a month or even more. We do think there might be a little bit of a move from PPOs to HMOs over the next couple years. A lot of the big Medicare YouTubers have talked about this. As time has gone on, these companies have tried out a bunch of Medicare Advantage offerings, and they're really starting to hone in on what works for them. So this is why last year, a lot of Medicare Advantage plans were termed. It looks like even more are getting termed this year. I wouldn't be surprised if even more get termed next year. So if you're in a Medicare Advantage plan, just double check, make sure you're protected, and make sure you have the coverage that you need. And the last piece to the Medicare trifecta is Medicare supplements. Unfortunately, these are increasing in price as well. It is not uncommon for our Medicare supplement clients to have seen 15, 20, or 25% increases in their Medicare supplement premiums over the past year. It just is what it is, guys. There's a lot of reasons for it, but it doesn't really change the fact that it's happening. We recommend shopping around and looking for a new Medicare supplement. It could be a move from a Plan F to a Plan G or a Plan G to a Plan N, or what's even better in many cases is moving from a Plan G with one company to a Plan G with another. A Plan G with Company A is identical to Company B. It is one of the biggest misconceptions in Medicare that there is any difference outside of price. These are federally standardized products. The companies cannot differentiate their service under any condition. You definitely want to shop around, see if you can lower your premium by $20, $30, $40, $50, $80, or maybe even $100 a month. It really isn't that uncommon to see savings that big. If you want to know what Medicare supplement underwriting entails, it's really fill out the application. There's about 20 health questions that just ask, do you have any of these conditions? They go through, they look at your medical records to confirm that everything you're telling is truthful, and then they decide if they're going to accept you. Now, some common denials are having a surgery coming up. It could be cataracts, it could be a hip surgery, really any major medical procedure, or having something like physical therapy. This is a big one too. People are going through short physical therapy stints and they can't switch at that particular moment. If you're looking at the more serious conditions, it tends to be things like having cancer in the past 2 to 5 years, having a heart attack in the past 2 to 5 years. It's really a major event that happened, and they just want to make sure there's been enough time from that event and everything is stable. It's pretty interesting because in a lot of cases, we're actually able to put a date in the future and say we're going to switch in about 3, 4, 5 months. So let's say you are 18 months cancer free and the company you want to apply with is asking for 24 months cancer free. What we will say is, I'm putting an appointment on the calendar in 6 months and we're going to try right then. And we have a very high success rate when we do that. So even if you can't switch Medicare supplements at this moment, don't be discouraged. There are plenty of options for you in the future potentially. Now, what are the situations where you're probably just going to get denied and there isn't too much you can do about it? Well, that is chronic conditions, things like Alzheimer's or dementia, AIDS, HIV. Now, one kind of scary trend in New Jersey is just, can people afford their Medicare supplements? You know, Part B is going from $185 to $206 a month. People are seeing $20, $30, $40, $50 a month increases in their Medicare supplement. They're also seeing, an increase in their Medicare drug plan. It's not that uncommon for people to see a $60 or $80 increase per month from all their Medicare costs combined. So while a lot of people love the Medicare supplement, they might be kind of forced to take the compromise we're about to talk about, which is a Medicare Advantage plan plus some extras. If you're struggling to pay those monthly costs of the Part B, of the Medicare supplement, of the Part D, plus potentially a dental and vision plan, you might want to think about this. What you're going to do is get a Medicare Advantage plan that has a lower monthly premium. It could be $0 a month, it could be $30 a month, something like that. Then you're going to get a couple add-ons that can help you with the catastrophic costs that could be associated with a Medicare Advantage plan. For instance, most Medicare Advantage plans have copays of somewhere between $250 to $400 a day the first few days you're in a hospital, and that can be a lot for someone on a fixed income. Luckily, you can get what's known as a hospital indemnity plan, which could be about $10, $20, $30 a month, and they will help you pay those costs. It's one of those things where the more you pay per month, the more coverage for that event you're going to have, but that is something to think about. There's also things like cancer and critical illness policies as well. A lot of people in Medicare Advantage plans don't know that they have a $7 or $10 or $14,000 out-of-pocket max potentially. If you have something like cancer, you could hit that out-of-pocket max very quickly if you get chemotherapy, radiology, something along those lines. So you get these critical illness policies. They could be $20, $30, $40, $50 a month. Again, the more you pay per month, the more coverage you get. But what these policies do is they will give you a flat lump sum in most cases. At least that's the ones we prefer to work with if you were to get diagnosed with, let's say, cancer. So let's say you pay $25 a month and you get diagnosed with cancer, the company's just going to give you a flat $10,000 check. That could help you with the out-of-pocket expenses with the Medicare Advantage plan. That could help you with, transportation. There's a bunch of different things you can do, and this is a great option if you can no longer afford the month-to-month associated with a Medicare supplement. We've covered a lot of ground in this video. We hope this is a great educational resource for you, but we really want to know what you think. Are your monthly costs associated with your Medicare supplement getting too high? Do you think the cost of prescription drugs is getting out of hand? Do you like Medicare Advantage? Are you worried about your Medicare Advantage plan leaving your area? There's so much to talk about, and we really want to hear your thoughts on everything. So please leave us a comment down below, like and subscribe. And if you know somebody who you think would learn a lot from this video, please share it with them. We want to give as much educational content out for free as possible. So please spread the word so more people know they can use this as a resource. And finally, if you want to work with an insurance brokerage that really cares about you and wants to do right by you, work with us here at NJ Life and Health. We have helped 4,000 New Jersey Medicare enrollees just like you and 5,000 Medicare enrollees in other states. We really want to help you out. We will bring you in for a no-cost consultation where we can see what your current Medicare situation is. We'll show you what options you have and where you could be as it relates to Medicare. And whatever you choose, we will help you with all the paperwork and ensure as smooth a transition as possible. We're local, we're family owned, we want to help you, and we have 3 full-time American customer support people that can answer your questions and make sure that you understand everything and that you have the right Medicare plan for your needs.